Welcome, everyone. This is the Alliance of Nurses for Healthy Environments Practice Forum monthly call for September. This presentation is titled Plastic Pollution and the Impact on Human Health. This session will be recorded and available to our members through Annie's YouTube channel and on our new learning platform, where attendees and those who watch the recording complete an evaluation and receive at least an 80% on a post-test are able to receive one continuing education credit for nursing CE. Our speakers today are Rashmi Joglaker, excuse me, and Tracy Easthope. Rashmi Joglaker, PhD, leads the Science Policy and Engagement Team at USCF's Program on Reproductive Health and the Environment. She comes with a wealth of knowledge and understanding of how toxic chemicals impact susceptible populations and communities, and is skilled in addressing these issues with decision makers in Washington, D.C. Rashmi completed her PhD in the Integrated Toxicology and Environmental Health program at Duke University, specializing in neurodevelopmental toxicology. Previously, she was a staff scientist at Earth Justice, where she partnered with lawyers and community leaders working on behalf of impacted communities to build the strongest scientific case for federal agencies to protect communities from harmful chemical exposures. Our second speaker is Tracy Easthope, who has an MPH and is a founding member and senior strategist with Healthcare Without Harm International. For 23 years, she directed the US-based Safer Materials Work Group of Healthcare Without Harm. Ms. Easthope helped develop and direct the successful market campaign work, leading procurement criteria development, and working with some of the largest health systems and manufacturers in the country to strategically leverage healthcare purchasing to drive safer furnishings, building materials, and medical devices in the US. She currently directs the global supply chain transformation efforts and helped lead a project jointly implemented by Healthcare Without Harm and the United Nations Development Program in 10 lower and middle income countries, which was designed to promote sustainable procurement in the health sector, to conserve resources, promote ethical supply chains, reduce toxicity of materials in health products, and reduce greenhouse gases. Currently, she is helping to lead Healthcare Without Harm International's engagement in the Plastics Treaty and to campaign and reduce and detoxify single-use plastic in healthcare. She has authored numerous resources and articles, most recently a chapter in a textbook on the challenges faced by the health sector from the intersecting crises of climate and chemical contamination. Ms. Easthope's training is in public health from the University of Michigan. I'm going to turn it over to Rashmi to get us started.
Thank you so much, Hannah, for that very kind introduction. I'm going to share my screen. Can folks see that?
Yes, we can see it.
Great. Okay. So thank you all for giving me the opportunity to join you today to talk about the toxic life cycle of plastics. As Hannah mentioned, I work at the University of California, San Francisco. I currently serve as the Associate Director of Science Policy and Engagement at the Program on Reproductive Health and the Environment, or PRE. I also serve as the Director of the Community Engagement Corps as part of the UCSF Earth Center, which stands for Environmental Research and Translation for Health. At both PRE and the Earth Center, we conduct research to understand how industrial chemicals and environmental pollutants largely impact people's health. And our mission is to create a healthier environment for human reproduction and development by advancing scientific inquiry, clinical care, and health policies that prevent exposures to harmful chemicals in our environment. We primarily do this by accelerating the pace of recognizing and preventing environmental exposures that affect reproduction and development to improve human health across the lifespan. So to begin, to set the stage, We live in a toxic chemical soup. This is one of my favorite quotes that I put into my presentations, which was said by Linda Birnbaum, who's the former director of the NIEHS. Toxic chemicals, as you all probably are aware, are widespread in our air, water, food, homes, and workplaces. And as a result, every day, people living in the United States are exposed to dozens of chemicals simultaneously. Toxic chemicals are found in our outdoor spaces and our indoor spaces, and they, really end up in the environment from polluting industries and from releases to our air, to our water, to our soil. And in the indoor space, exposures can stem from contaminated building materials and household and consumer goods, including personal care products, toys, textiles, and even food packaging. So to kind of put numbers behind the extent of toxic chemical exposures, the production and importation of chemicals is huge in the United States. It amounts to about 30,000 pounds of chemicals produced per person per year. That amounts to 9 trillion pounds of chemicals per year. And that includes a variety of chemicals that are used in plastics and found in everyday products. This includes chemical classes like PFAS, which I'll delve into later, flame retardants, phthalates, and bisphenols. And there are around about 40,000 chemicals that are currently used in commerce in the United States. Also, every year, there are thousands of workers who manufacture billions of pounds of these chemicals in the United States. There are also residents of communities who live in proximity to the facilities where these chemicals are manufactured, also known as fence line communities. And both of these groups experience disproportionate exposures. This is also something I'll touch on later in the talk. So the problem is that most of the chemicals in commerce have not been tested for safety. So we really have this kind of iceberg problem. In fact, the vast majority of them, apart from around 350 that are regularly biomonitored in the United States, measurements in humans really have not been conducted. Safety evaluations have not been conducted. So we have this problem where we're exposed to thousands of chemicals every day, and we really don't understand the effects that they're having on people. Because of their widespread nature, we do know that toxic chemicals end up in people. There are large-scale biomonitoring studies that have shown that certain categories of chemicals, including PFAS, that stands for per and polyfluoroalkyl substances, also known as forever chemicals, maybe some of you have heard of them, have been found in virtually all people living in the United States and virtually all people living in the world. So it probably comes as no surprise that pollution is the leading cause of death worldwide. It accounts for around 9 million deaths annually. This includes air and water pollution, pollution from lead and other chemicals, and toxic occupational exposures. This is greater than 3 times the global deaths from AIDS, tuberculosis, and malaria combined. Chemical pollution is estimated to be responsible for around 1.8 million deaths. This is kind of a subset of toxic pollution, but this number is probably an underestimate, since less than 5% of the thousands of chemicals that are registered for use globally have actually been adequately studied. And most countries don't require testing for chemical health harms or disclosure abuse. So really what we're seeing as a result of all these toxic chemical exposures is, over the last few decades, a marked shift in the burden of communicable versus non-communicable diseases. And as shown in these graphs, in 1990, as shown in the graph on the left, communicable disease took up the highest burden at 46%. And on the same graph, you can see a shift over time to non-communicable diseases. And by 2019, this represented 64% of disease burden. That translates to a multitude of disease types, with the steepest increase seen in liver disease, mental disorders, neurological disorders, respiratory disease, and cardiovascular disease. And those are all shown in the graph on the right. The shift in burden towards non-communicable diseases results from significant reductions in communicable and preventable diseases as incomes rise and overall health and living standards improve. So in high-income nations, non-communicable diseases typically account for more than 80% of disease burden when you separate it out. In contrast, communicable diseases tend to be low at less than 5%. The opposite is true in low-income countries. Communicable diseases still account for more than 60% across many countries. So public health experts agree that pollution-related disease merits urgent attention, but really in the same breath that very little progress has actually been made in this space, particularly in the most polluted areas of the world. And really what we're facing is a public health crisis. A recent study highlighted that we are now operating outside of the safe planetary boundary for chemical pollution. This means that the annual production and releases of novel entities or chemicals is increasing at a pace that has surpassed our global capacity to assess and monitor them. And so what are the underlying causes of this kind of chemical contamination crisis? Obviously, the steep rise in chemical production is occurring in parallel with a rise in plastic production. We've seen a 15-fold increase in chemical production over a 60-year time period that's shown in this graph. Chemical production is rising exponentially, largely due to the increased demand for petrochemicals and plastic production, which is shown in this graph over here. The production of chemicals, particularly for plastics, has been on a constant incline over the past several decades, and the production of these chemicals is highly polluting, as I'll touch on in this talk. So the graphs that I've shown here show very similar trends and were taken from a recent publication by Dr. Tracy Woodruff, who is the director of PRI and the Earth Center. And this article was recently published in the New England Journal of Medicine. So what you'll see in panel A is this steep rise in fossil fuel consumption globally over the past several centuries. And as you can see, oil, gas, and coal consumption has increased dramatically since the 1900s. Panel B shows historical and projected global primary plastic production. The shaded area actually indicates a period known as the Shale Revolution, which occurred in the United States between 2000 and 2010. So currently, petrochemicals account for 12% of the global oil demand, but they're on course to account for more than a third of the growth in worldwide oil demand by 2030, so just in 6 years, and nearly half the growth by 2050. As part of petrochemical growth, plastic production is predicted to grow by a factor of almost 3, from more than 400 million metric tons to 1,100 metric tons by 2050. And that means that there will be more products with more chemicals to which humans are exposed. So I wanted to spend a little time breaking down the life cycle of plastics to begin to understand the extent to which plastic production impacts human and environmental health. And again, it's critical to examine the health and environmental effects at every stage of the plastic's life cycle, whether caused by the plastic itself, the drilling that's required to obtain plastics precursors, or by toxic additives that are kind of added to plastics. So this graph breaks down the plastics life cycle. And chemical pollution is, from this life cycle is really driven by the extraction, production, and use of fossil fuels. So plastics are made from the energy-intensive conversion of feedstocks or raw materials. Fossil fuels, either from oil or gas extraction, make up the feedstock for most of the plastics that are produced. Approximately 25% of the crude oil produced in North America is used in petrochemical production, primarily ethylene, rather than transportation fuel. For example, ExxonMobil produces more oil and gas than any other US energy company and is also one of the largest producers of phthalates. And that's because phthalates, which I'll touch on later, are a class of chemicals that are added to plastics to make them more flexible. The process of obtaining fossil fuels through drilling or fracking is highly polluting, and it can result in the release of hundreds of toxic chemicals into the environment. This includes carcinogens like benzene, toluene, various volatile organic compounds like formaldehyde, 1,3-butadiene, heavy metals like lead and arsenic, radioactive elements, and certain chemicals that are actually found in fracking fluid like methanol, ethylene glycol, and in some cases even PFAS, which I mentioned before. Ethane is the primary plastics feedstock that's derived from natural gas, which is then turned into ethylene via a process called cracking. The production of ethylene for plastics manufacturing is more lucrative than the sale of methane and ethane for fuel, heat, or electricity. So again, just to put scale to this. And ethylene that's produced in that cracking process is a precursor for most plastic products and other chemicals that we encounter on a daily basis. So once ethylene is cracked from ethane, ethylene is combined into polymers. Some of them you might be familiar with, like polyethylene terephthalate, PET, which is commonly used to make plastic bottles, and other plastic intermediates. They're processed to incorporate chemical additives such as plasticizers and flame retardants. And this entire process results in the release of both these intermediate chemicals that are formed through this plastic polymerization process, as well as the release of chemical additives. So intermediates include chemicals like vinyl chloride. Many of you have probably heard of the East Palestine train derailment. Vinyl chloride was one of the main culprits. It's a potent carcinogen. It's also the precursor to polyvinyl chloride, very, very toxic chemical. And in terms of additives, I talked about PFAS, the forever chemicals. Phthalates are plasticizers. They're also potent endocrine disruptors, and they're used to make plastics more flexible. You'll also see flame retardants that are commonly added to plastics, bisphenols, which are added to plastic water bottles. Many of you have probably heard of bisphenol A. It's also a potent endocrine disruptor. And then several volatile organic compounds like formaldehyde, which is another potent carcinogen. Oops, frozen a little. So once these raw polymers are produced, they're then often sold in various forms like resins, granules, and tiny spheres called pellets. And these pellets are then molded into plastic products that then end up in myriad consumer products that we interact with on a daily basis, like toys, food packaging, building materials, electronics, and others. And so using these consumer goods then also exposes people to toxic chemicals, whether it's from the plastics themselves or it's from the toxic additives that are found within them, as I just walked through. Once they're released into the environment, plastic fragments are formed, and they're formed from the discarded plastics. And they can break down into various particles, which can be classified as macroplastics, microplastics, or nanoplastics. So macro, micro, or nanoplastics contaminate and accumulate in air, waterways, agricultural soil, rivers, and oceans. And as a result, our food chain and our water supply are contaminated with these plastic fragments. This environmental plastic can also leach the toxic additives that I just walked through. They can also concentrate toxins and pathogens that are already in the environment, acting as reservoirs. And they are very bioavailable for direct or indirect human exposure. So this graph gives a little bit of an idea of the scale of the size of these plastic fragments. As you can see, microplastics are less than 5 millimeters in diameter. They're mostly invisible to the human eye. Nanoplastics can be as small as the width of a strand of DNA, making them extremely mobile and readily absorbed in the human body. Micro and nanoplastics are also respirable and inhalable, which increases their likelihood of circulating through the human body and reaching all organs and tissues. And as no surprise, research has shown that microplastics and nanoplastics have penetrated nearly every organ system. This includes the brain, the placenta, the developing fetus, and as some recent research has suggested, human testes. Similarly, because of their ubiquity in our indoor and outdoor spaces, plastic additives have also been found in most people, including during vulnerable life stages like pregnancy. We conducted research at UCSF and found that pregnant women were exposed to more than 43 different industrial chemicals, many of which are toxic plastic additives, and those are highlighted here in red. Our team of researchers examined the urinary chemical metabolites of over 170 pregnant women and found dozens of chemicals, some of which have not previously been biomonitored in their urine. And the chemicals highlighted in red, as I mentioned, are common plastic additives, including classes of chemicals like phthalates, which are highlighted on the left. There are also PFAS, which are on the right, and then some flame retardants. There were also marked racial disparities in this study. Many analyte concentrations were higher among women of Hispanic ethnicity compared to those of non-Hispanic white women. National biomonitoring studies like those conducted through the CDC have also corroborated these findings, and they continuously show that we are exposed to dozens of toxic chemicals, and those exposures start from in utero. And as a result, to a disturbing extent, babies are actually born pre-polluted with chemicals in their bodies, including microplastics. Our research has also shown significant links between prenatal exposures to toxic additives and adverse birth outcomes like lower IQ, changes in visual memory function in infants and children. And we know that these exposures collectively are taking a measurable toll on people's health. They can increase the risk of cancer, infertility, asthma, neurological disease, cardiovascular disease, and multiple impacts on children's brain development. And timing matters. Exposure during pregnancy, for example, can impact the developing fetus, and it can result in behavioral disorders later in life, cancers, learning disabilities, and asthma. Coming back to the toxicity of the chemical additives, there were several high-powered systematic reviews that were conducted on many of these chemical classes. And they show time and time again that these chemicals are associated with kind of irreversible health harms, decreased fetal growth, decreased antibody production in response to vaccines in children and adults for PFAS. For phthalates, male reproductive toxicity, decreased fertility, preterm birth, impaired neurodevelopment from exposure to flame retardants. Bisphenols affects ovarian development and function. There's also volatile organic compounds like formaldehyde that are strongly linked to cancer, to reproductive toxicity. Cancers like nasopharyngeal cancer and leukemia, really serious health harms that not one or two studies have shown, but have been underscored by dozens of studies and systematic reviews. So a lot of these chemicals are also potent endocrine disruptors. These are chemicals that interfere with the function of hormones through multiple mechanisms. And this, again, results in many of the adverse impacts that I already walked through: irreversible harm to the reproductive system, potential harm to the developing fetus, potential infertility, hormone-sensitive cancers, neurodevelopmental harm. We also conducted a high-powered systematic review to examine the health impacts of microplastics, so moving from chemical additives to the plastics themselves. We looked at over 2,000 studies and found that microplastic exposure was strongly linked to harm to the digestive system, to the reproductive system, and to the respiratory system. Microplastics also expose us to the plastic additives that are found in all plastics, and these are the ones that I've already walked through and the health effects I've already walked through. So again, just another source of exposure to the additives and to their toxic health harms. We also know that exposures are not equal. Certain communities, certain groups of people experience disproportionate exposures. In addition to the people who work in facilities that manufacture plastic, people who reside near the facilities that either make plastic precursors, are involved in petrochemical production or in plastic additive production, experience disproportionately high exposures to these chemicals. And numerous studies have shown that these communities are more likely to be people of color, they're more likely to live near clusters of facilities, and they're more likely to be more susceptible to harm from these exposures. One example is Cancer Alley, which is a stretch of 11 parishes in Louisiana, the heart of the petrochemical industry. They have a cancer risk in those counties that's 47 times higher than EPA's acceptable levels. And that's largely due to releases of chemicals like formaldehyde and 1,3-butadiene, which again are released during the plastics manufacturing process. We also know that Black and Latina women experience disproportionate exposures to phthalates. Some studies have shown that it's through personal care product use. We also know that these disproportionate exposures happen during pregnancy and can lead to adverse birth outcomes like adverse birth outcomes through large cohort studies. We also know that children are disproportionately exposed, largely due to hand-to-mouth behavior, crawling behavior. They're ingesting more household dust. Household dust is a potent reservoir for a lot of microplastics, nanoplastics, and the toxic additives that are found in plastics. And we know that in addition to greater exposures, there are certain subpopulations that are more susceptible to harm from these exposures due to factors like pre-existing disease, life stage, or factors that are extrinsic, like food insecurity, experiencing poverty, or racism. We know that experiencing, baseline risk from intrinsic or extrinsic factors leads you to a certain likelihood to develop an adverse health outcome. But when you experience these factors in combination, you're very likely, or even more likely, to experience adverse health outcomes. And so taking all of this together, the life cycle of plastics is highly toxic. We know it's associated with a slew of adverse health effects, and we know that experiencing susceptibility factors, both intrinsic and extrinsic, can magnify those health effects that you experience. So we also know that individual action is not enough and that we need systemic changes to really tackle this problem. Some solutions are to increase research. We need more widespread sampling. We also need more health effect studies using in vitro models, using in vivo models, focusing on epidemiologic studies. And then we also need policies. We need regulations in place to really reduce people's exposures to plastics. Most exposures can't be eliminated due to a lack of laws on data, disclosure, and action, but public policies are essential to reduce fossil fuel extraction, production, and use. And really factoring in, while those policies are being developed, the cumulative impacts, the impacts of not just experiencing one chemical exposure at a time, but multiple chemical exposures and non-chemical stressors like those susceptibility factors that in combination make people most susceptible to harm. So at PRE, we've done a couple of things to tackle this. In 2015, we partnered with the International Federation of Gynecology and Obstetrics, or FIGO, to develop a scientific opinion on the reproductive health impacts of toxic chemicals, which includes a lot of plastic additives and many of the classes of chemicals that I discussed today. This resulted in FIGO recommending ways to prevent or reduce the burden of toxic chemical exposures in patients. We also partnered with HEAL and our communication staff to generate these patient-facing materials that provide recommendations to reducing everyday toxic exposures, especially during pregnancy. And many of these recommendations are kind of tailored around avoiding exposures to plastics or plastic additives. We also recently launched our Toxic Matters website, which also provides distinct recommendations on how to reduce the impact of everyday toxic chemical exposures. And this also exists in pamphlet form, and it will eventually be translated into multiple languages. And this is kind of a screenshot of what our web version looks like. We're also very active in trying to make policy and systems level changes happen. We submit public comments on rulemakings that are released typically by the EPA under the Toxic Substances Control Act. One area that we've been active recently is around formaldehyde. The draft risk evaluation was released recently from the EPA that was very flawed, and we submitted public comments highlighting what those scientific flaws were and how to improve that process to ultimately improve public health. We also are involved in the legislative space. We advocate the best available science to our decision makers to help them use that science to strengthen the laws for chemicals in this country. And then we also leverage advocacy. We have a program at the Earth Center called the Reach the Decision Makers program, which brings together doctors and nurses, academics and scientists to try to answer pressing environmental challenges in their communities. And some of them are also centered around chemicals that are found in plastics. So in conclusion, the life cycle of plastics adversely impacts health. It's key to reduce the burden of plastic production and exposures, which will require systemic changes. And you can all be involved in that systemic change in the ways that I just highlighted. And I'm happy to answer any questions after this presentation. Thank you.
Thank you so much, Rashmi. I will get Tracy's slides pulled up here.
Thank you. And thanks for inviting me to speak today. I'm really delighted to be with everybody. And so if you want to go to the second slide, once you get that. Yeah, thanks. So I want to make a few points in my presentation today. First, and there's a little bit of overlap, I think, but complementary to Rashmi's presentation, I'm going to be focusing a lot on plastics in the healthcare sector. But I want to first make the point that the manufacture, use, and disposal of plastic releases toxic chemicals and greenhouse gases, harming people and the planet and contributing to a global public health crisis. Rashmi has given you a lot of information to support that. That healthcare is contributing to the unsustainable burden of plastic pollution, and the problem is projected to get worse. Although plastics are widely used in healthcare, they can be dramatically reduced and detoxified, and many health systems are already showing the way. Finally, I want to touch on the Plastics Treaty, which represents a critical opportunity to improve health and to protect the planet. And I want to emphasize the role of the healthcare sector and nurses in particular in both reducing plastic pollution and in making the case for broader policy change. Next slide. While plastics have emerged, great, thanks. While plastics have emerged as an indispensable part of medical care because they're lightweight, durable, and can be made sterile, it's also clear that they are responsible for significant harms to human health, the economy, and our environment. Next slide. The global medical plastics market is projected to increase from 26 to $41 billion in the next 5 years. That's a 10% compound annual growth rate. This explosive growth is driven primarily by the demand for single-use medical devices. PVC, a problematic plastic, is still the most widely used medical plastic. Next slide. Part of what is driving the increase in single-use plastic is a perception that they can improve infection prevention. Medical experts are starting to challenge that idea. In this article in the Journal of the American Medical Association, the authors conclude, for certain medical devices, single-use disposability may be the best solution, but broad-scale, unfettered, and irrational adoption of disposable items in the name of infection prevention is harmful, unsustainable, and unacceptable. Next slide. It's estimated that 14,000 tons of waste is generated daily in US healthcare facilities, and about 20 to 25% of that waste is plastic. Yet some estimates suggest 85% of that waste could be recycled if it were designed to do so. Less than 10% of healthcare waste is recycled now. Almost all of it ends up in landfills, incinerators, or in the natural environment. Globally and in the US, COVID resulted in huge increases in plastic waste, and a significant percentage was mismanaged, and most of that waste was generated by hospitals. Next slide. The huge increase in single-use plastics during the pandemic didn't just generate mountains of waste, it was also responsible for a big uptick in greenhouse gases. One study estimated that the additional personal protective equipment used in healthcare in England alone during just the first 6 months of the pandemic added an extra 1% to England's carbon burden. The greatest contribution was from gloves, aprons, face shields, and surgical masks. But researchers also found they could reduce the environmental cost by 75% through a combination of strategies, including reducing unnecessary glove use, switching to domestic manufacturing, using reusables where possible, and optimizing waste management, all while maintaining safe levels of protection for staff and patients. Next slide. Even without a global pandemic, as Rashmi was mentioning, global plastics use is projected to grow at an unsustainable rate, quadrupling by 2050. Single-use plastics account for 35 to 40% of current production and represent the most rapidly growing segment of plastics in general, not just in healthcare. Next slide. All of this plastic is going somewhere. In 2023, the US shipped a huge amount of plastic waste to other countries. 1/3 of it was to countries that lack the infrastructure to manage it. Of that trash, much of it ends up in the global south, where it is often burned in the open or discarded in waterways, damaging the health of local communities and ecosystems and adding to climate impacts. It's estimated that between 400,000 and 1 million lives are lost each year in low and middle income countries due to mismanaged waste. Next slide. So all of this, as we keep mentioning, is creating a global public health crisis. Next slide. And I'm going to go into a little bit of detail about the chemicals in plastics. You've heard quite a bit about it from Rashmi and the impacts, but there was a study released earlier this year by the Norwegian Research Council, which estimates the number of hazardous chemicals associated with plastics. They have determined that the number is much higher than previously thought. Next slide. The report found, this was just for plastics, the report found more than 16,000 compounds are used or unintentionally present in plastics, and less than 6% of those chemicals are subject to global regulation. Astonishingly, for 66% of those chemicals, we have no hazard information. And for those that are known, for the 3,000 known chemicals of concern in plastics, most are unregulated. The authors point out that this complexity of the chemicals in plastics essentially means that there can be no effective regulation of chemicals in plastics. So just to note, while this is the state for most plastics, medical devices must go through more safety testing. These chemicals that are in plastics don't just stay in the plastics. Communities and workers are exposed during production. And once in products, these chemicals can leach out, as we've heard, contaminating people, patients, and the environment. Recycling of plastics can recirculate these hazards into new products. Incineration can release these chemicals to local communities where they're burned. And improper disposal also releases these chemicals to the environment. Next slide. And as you've also heard, there are peer-reviewed studies demonstrating health impacts at every stage of the plastics life cycle, from extraction in coal mines and oil and gas fields, to the many stages of production, and finally to disposal. Waste and recycling workers and communities surrounding these facilities suffer these health impacts. Some of the impacts that have been documented are noted on the screen. The adverse effects are not evenly distributed. They disproportionately affect poor and marginalized populations. Next slide. Even if you don't live next to plastics production or disposal facilities, we're all exposed. And Rashmi did a wonderful job talking about all the ways in which we're exposed and all the chemicals that we're exposed to. Plastics release toxic chemicals during use and disposal, including additives and monomers, and biomonitoring surveys in the US document population-wide exposure to these chemicals. This is just one example. She mentioned some others. The CDC's National Biomonitoring Program finds, for example, bisphenol A and phthalates, two very common compounds used in plastics, in the urine of nearly all people tested. Children aged 6 to 11 years had the highest levels, followed by adolescents aged 12 to 19 years. Next slide. So I won't go into detail on this slide, but just those two classes of chemicals, bisphenols and phthalates, are associated with a multitude of health impacts shown on the screen and also previously mentioned. And a recent study actually linked them to cardiovascular and related health issues. This is just two classes of chemicals among the many, many, many that are in plastics and that we're all exposed to. And you heard some of the others in the earlier presentation. Next slide. Exposure to chemicals of concern in plastics also costs the world's healthcare systems. According to a study published this year, the researchers looked at just one broad endpoint, endocrine disruption, and just 4 classes of chemicals. They found exposure to these chemicals is estimated to cost the United States $250 billion in increased healthcare costs per year, or 1.22% of the gross domestic product. Next slide. Chemicals of concern in plastics can also threaten patient safety. For example, PVC plastic requires many additives to give it properties like flexibility. Plasticizers like phthalates used in medical devices have been demonstrated to leach from those products and result in direct patient exposure. Many government agencies have concluded that some patients are likely to be exposed to potentially unsafe amounts of the plasticizer DEHP while receiving medical care, including sick infants treated in neonatal intensive care units. Substituting PVC and DEHP with safer alternatives is part of what's needed to reduce the toxicity of plastics in healthcare. Healthcare Without Harm has written extensively about this issue, and there's a few reports on the screen. Next slide. And as you've heard, it's not just the chemicals in the plastics that pose threats to human and planetary health. It's also the micro or nanoplastic particles that are created when plastics break down. Micro and nanoplastics have been found everywhere we've looked, as you've heard, in the air, in soil, and even in clouds, where they can affect cloud formation and then fall out to Earth as plastic rain. They are in our drinking water and in the food and liquids we package in plastic. They are found in every protein source tested and even in non-meat-based alternatives. As a result, as you heard, they are in all of us, in organs and bodily fluids. New studies come out almost monthly. This May, a study of 91 brain samples found they contained an average of 10 to 20 times more microplastics than the other organs. The study reported the brains averaged 0.5% plastic by weight, which had increased from the earlier brains they tested in 2016. In another study, as you heard, plastic was found in every placenta tested. The same plastics used in our products and packaging is the plastics found in the organ that holds the developing baby. Next slide. Again, we're just starting to learn what exposure to microplastics does to our health. Animal models show a variety of toxic effects, including lung inflammation, oxidative stress, insulin resistance, immunotoxicity, and neurorepro and developmental toxicity, as well as impaired learning and memory. Those are in animal models. You heard about some additional studies in humans from Rashmi. I want to highlight one important new human study published in the New England Journal of Medicine this year. Researchers showed that surgical patients who had a buildup of micro and nanoplastics in their arterial plaque had a 4.5 times greater risk of heart attack, stroke, or death from any cause in the 3 years after surgery than those who did not have plastics in their plaque. Next slide. Plastics also, as you've heard, are linked to climate change. Greenhouse gases are emitted at every stage of the plastic's life cycle, from extraction to disposal, including incineration. Plastic production is responsible for more greenhouse gases than is generated by the entire country of Brazil, and the numbers are only projected to grow. Greenhouse gas emissions from plastics could reach 10 to 13% of the entire remaining carbon budget by 2050. According to one analysis. But most importantly, emissions from the plastics life cycle threaten our ability to meet global climate targets if they continue as they are. Next slide. There is an alternative to unfettered plastic use in healthcare. Healthcare Without Harm promotes a waste hierarchy focused on rethinking, redesigning, detoxifying, and eliminating unnecessary products as a critical first step in addressing the plastics crisis. We must first eliminate unnecessary plastic items and avoid single-use plastics where possible, and use the least toxic plastics. The types of plastics that cause the most significant environmental and human health damage should be phased out to protect health. Packaging should be reduced and reused to the extent possible. Where plastics are needed, they should be designed to be reusable and reprocessable. Recyclable plastic must not contain chemicals of concern in order to avoid continually recirculating hazardous chemicals. Recovery and disposal are last resorts for all materials. All false solutions should be avoided, including incineration, waste to energy, and chemical recycling. Next slide. Healthcare Without Harm and Practice Green Health have created toolkits, reports, challenges, and awards that provide a roadmap for health systems that want to take action to reduce and detoxify plastics at your facilities. Next slide. We also have lots of case studies in all kinds and sizes of facilities. There are examples of plastics reduction and detoxification in the US and throughout the world, and innovations in nearly every department in the hospital, and alternatives for many high-volume products. For many uses, we already know how to redesign, reduce, reuse, detoxify, and recycle, what we must continue to use. Next slide. But all of this won't be enough if we continue to produce plastics at the current rate. We need to address the plastics crisis with national and global policy. The UN Environment Assembly passed a historic resolution in 2022 to develop an international legally binding treaty to end plastic pollution. Formal negotiations began in November of that year. The ambition is to complete the negotiations this November in Korea. Next slide. Healthcare Without Harm has been involved in treaty negotiations from the beginning and prepared documents highlighting the urgency of the action on the issue. We outline key principles that should guide treaty negotiations. We believe that the health of people and ecosystems must be at the center of the treaty. Next slide. However, some governments have proposed that the health sector be exempted from the treaty. In response, Healthcare Without Harm is leading a campaign to challenge this idea. We circulated a global sign-on letter from health professionals urging delegates to craft a strong treaty that does not include a blanket exemption for the health sector. An exemption would be inconsistent with the health mission of the sector and would stall momentum and discourage innovation for plastics reduction, reuse, and redesign. An exemption would also be contrary to the growing global movement for sustainable healthcare. Instead, the letter urges special consideration to assure the continued safe and reliable provision of care in healthcare. The letter also calls for a just, ambitious, and equitable treaty that respects human rights, limits the production of plastics, prioritizes detoxification, and requires transparency of information and consideration of the full life cycle of plastics. Next slide. The letter was signed by groups and individuals representing more than 6 million health professionals globally from 75 countries. There were actually more individual signatories from the US than from any other country. Next slide. So this is a critical moment for health professionals to influence the direction of the treaty and the way in which the world will address the plastics crisis. There's still time for nurses to sign the letter before the final treaty negotiation session in November. You can see the URL on the screen. We urge you to sign and work with any other organizations that you might belong to sign as well. And maybe Annie can consider signing. Next slide. Finally, as the Director General of the World Health Organization said recently, if the Earth were a patient, it would be admitted to intensive care with a fever, its lung capacity compromised, and its waters, its lifeblood contaminated. It's not just the Earth, it's all of us too. We're facing an urgent crisis and a need to act, so we urge all of you to get involved in the effort to reduce and detoxify plastics at your facility and push for policies at all levels to address the plastics crisis in order to help protect all of us. Thanks so much.
Thank you so much to both of our speakers. That was wonderful information. We have about 7 to 8 minutes left on the call. Before I get to the great question in the chat, I would like to just invite everyone to we have some great webinars coming up on some of the issues that were mentioned in both presentations. Next month, we have some folks from the Curtis Bay Community Land Trust who are going to come and talk to us about medical waste incineration and health and how they are advocating for the communities around the Curtis Bay waste incinerator. And in November, we are moving even forward on this presentation and talking about reducing plastic use in the health sector and beyond. So what nurses can do to work with their organizations and on a personal and organizational level to reduce plastics and benefit health. So I just wanted to invite you to those webinars. A great question we had in the chat from Sarah. Can you describe what regulatory process the plastics used in medical devices go through?
Yes, I cannot describe it in detail, but it is very extensive. They call it stability testing that the FDA does. It's multi-layered. It typically takes years to get a new device approved. So, which is why we think that there should be special considerations for plastics used in healthcare because of these long timelines. On the other hand, there are a lot of innovations already out there on the market that have yet to be taken up, and lots of things in the pipeline. So, but I can't describe in detail, and it really depends on the nature of the device. Some devices require much more extensive testing. And they do require some testing of what leaches from products. They require products to provide information on the full ingredient list of what's in products. They require information on impacts associated with any chemicals that are leaching from them. But again, it varies depending on the purpose of the device. So maybe, I hope that's responsive.
Thank you so much.
Yes, thank you. And one question, and I know we will talk a lot more about this in November when we expand on this webinar, but just to summarize, Katerina asks, what are some examples of systemic changes regarding the use of plastic that each of us as nurses has the power to make?
Want to go first, Rashmi?
Sure, yeah. So one area that we specialize in at PRE is the federal regulation of chemicals. So I mentioned very briefly at the end of my presentation, the Toxic Substances Control Act. We do a lot of policy work related, or it's also called TSCA. We do a lot of policy work related to TSCA. We often leverage scientists, doctors, and nurses to join our public comments that are often critiquing regulations that EPA proposes under TSCA. This is a really kind of easy area where medical professionals can get involved. You can sign on to our comment letters. A lot of the times we're pointing out cases where EPA has not considered the full breadth of exposures to chemicals found in plastics like formaldehyde, 1,3-butadiene, flame retardants, PFAS. We're also highlighting communities that EPA has left out of their assessments, like fence line communities who are experiencing disproportionate exposures to these chemicals. So that would be kind of an easy, now-ish timeframe kind of engagement that you could become involved in. And really what that, ultimately will hopefully result in is stronger regulation of chemicals that are added to plastics. Another kind of unexplored area is getting EPA to regulate microplastics. Right now, they're really not regulated. There's really not like a comprehensive risk evaluation on microplastics because they're complex mixtures. So that's also kind of an unexplored space, but an area that doctors and nurses can get involved in, given the extent of plastic exposure in the healthcare sector. So there's lots of ideas and lots of ways, and I'll let Tracy finish this thought because I know you have a lot of excellent ideas.
Yeah, well, as I mentioned, Healthcare Without Harm and Practice Green Health have so many tools, resources, checklists, all kinds of tools to help clinicians who are interested in working within their hospital systems to make change. And so I think, the first thing you can do is just support efforts that are underway in your hospital. And be a booster for any efforts that are underway in your hospital, because sometimes people are resistant to change. So that's certainly just a very simple baseline thing you can do. Secondly, you can start to be engaged to understand where you might be able to reduce plastics, understand the sustainability of people working within your health system, what initiatives are ongoing, where you might be able to plug in. And then once you get plugged in, there's all kinds of tools and resources that we can provide that would give you a good idea of where to go. But another thing that you can do really simply is to just simply sign this global sign-on letter related to the Plastics Treaty, to urge a strong plastics treaty, because although the US doesn't necessarily sign treaties, many countries do, and it really can influence what happens with plastics globally. And so it's this amazing opportunity. Also, the US government recently changed their position, and they are now supporting limits on production of plastics, which is huge. And so we want to support that and show that there are a lot of healthcare practitioners out there who support an aggressive approach to reducing the hazards from plastics and plastics production. So we're really pushing people to sign and get other organizations to sign.
Thank you so much to both of our presenters, Rashmi and Tracy. I will be sure to add that link to the sign-on in the follow-up email that everyone will receive. Again, thank you all for attending this month's webinar. Hopefully we'll see many of your names in the next couple months as we keep exploring this topic. Thanks, everyone.
Thanks all.
Thank you all.